Hi, everybody. Dr. Vass. I know it's been a while, but we've been getting a lot of questions and there's a lot of concern out there. And Coach Shaw and I felt it was important to address this. Um, we are, Rocky Mountain Regenerative Medicine. We're here to support you. Fortunately, Coach Shaw and I are still plugged in with our emergency medicine group. Our group runs medical direction for Northwest Metro Denver. I'm personally friends with the physician who we have in place at the top, running medical direction and in charge of that system for our group. Here's what's happening. Okay, Denver metro area is approaching its bed capacity. You're going to hear this term a lot. What does that mean? What it means is the number of staffed medical beds are reaching its close to full occupancy rate. Most hospitals actually have additional physical bed space. So when you hear people talking about bed capacity is referring to the number of beds in a hospital that are appropriately staffed, that have a nurse, the ancillary staff, the CNAs, the lab techs, the x-ray techs, the physician coverage necessary to adequately take care of a person who's in that bed. So we are not reaching physical bed capacity, we are reaching staffed bed capacity. And I know that can sound very scary, but I personally am not fearful or scared at all. And here's why. We're prepared for this, okay? I know I can be critical of the traditional medical system here in the United States, but this is what we do best, okay? This is what traditional medicine does best, is the acute stabilization and treatment of severe acute illness and injury. We are better than anybody in the world. Our ICUs are better. Our emergency medical systems are better. This is where we shine, okay? Preventative medicine, the kinds of things we deal with in the clinic, not so much. But acute illness, the type of illness that is precipitated by complications from COVID-19, not only are we better at it than anybody in the world, we now have over 8 months of experience at dealing with this illness. The system is way better prepared. The physicians, the nurses are way better prepared to handle these cases than we were in March, April, May. So bear that in mind. And then what I also want to encourage you to consider is, what can you do? Okay. You can listen to the advice. I agree, masking, social distancing, limiting contacts. Yes. I would encourage you to think beyond that. And here's what I personally feel is fundamentally important for each and every person. If you want to stay healthy and you want your family to stay healthy, here's what I think you should be focusing on. In addition to these other things that everybody's talking about, get your rest. Okay. Do what you need to do to sleep and rest adequately. Number one, okay? 2, eat a healthful diet. You know how to do that. We've got great resources for doing that here. Take care of yourself. Eat delicious, healthy food. 3, I personally feel that it's imperative that I personally feel that it's very important to supplement vitamin D, vitamin C, zinc, and a high-quality multivitamin. There are other things you can do, silver, echinacea. I mean, there's a whole lot more you could do, but I would focus on those things. Vitamin D, zinc, vitamin C, high-quality multivitamin. Next, we live in beautiful, sunny Colorado. Get outside, get your feet in the grass, breathe in the air. Appreciate the loved ones, the incredible community we have around us, people who are health conscious, who are open-minded, who are incredibly resourceful. Reflect on that positivity. And I express gratitude for you, for who you are and what you bring to us at Rocky Mountain Regenerative Medicine. And I would encourage you to express that gratitude, whether it's inwardly or outwardly, on a daily basis. Finally, know that this situation that you're hearing about, we are prepared for. Okay. There is a triage system that's in place that I know the medical community has asked Governor Polis to implement, that would enable additional control from the medical system to deal with medical traffic. And that's not going to affect walk-in traffic. If you walk into an ER, you're not going to get turned away. What that affects is ambulance traffic and air medical traffic. So if you get into some kind of medical vehicle, you might end up somewhere that's geographically a little bit different than where you expected, because that is going to be controlled centrally to help distribute volume so that no one hospital gets overwhelmed. Okay, that's the system that's in place. It's been in place since the spring. It hasn't had to be activated, but I now, the medical community in the Front Range has asked the governor to initiate that implementation. You're probably, I don't know how much they're going to talk about it, but that's coming soon. The next thing is that although we talk about we're reaching bed capacity, there actually is an emergency hospital it was set up in the spring. It's in a large, what is normally a public convention gathering area in Denver that has basically been repurposed as low acuity hospital beds, which could decompress a lot of that hospital space if it's needed. So know that, though everybody's talking about surge, we're reaching our capacity, there's a plan in place for this, okay? There is surge capacity available. I have every confidence. In fact, our ER group is staffed, has been contracted to supply physicians for that hospital. I could end up working there if needed. I don't want you to get fearful, wrapped up in, for lack of a better term, the hype, the COVID hype. And the last thing I would really, really encourage you to do for your own health and benefit is to limit your media exposure. I personally have a defined period of time that I will allow myself to either listen, watch, or be exposed to, whether it's social media, whether it's a commercial news outlet, whether it's a public news outlet, whatever your outlet is. You really don't need more than 10 or 15 minutes a day to get everything that you need to get to be informed. Seriously. It will be beneficial for your health. You'll be able to sleep better. You'll be able to rest better. You'll be able to have a better positive mental and outlook, which will directly affect your physical well-being. And I personally am not fearful at all. That doesn't mean I'm being cavalier. It doesn't mean I'm being negligent. But I would encourage you to try to unplug from how news is delivered to you and control it, because you can, and it will be better for your health. So Koshal and I are here, even though the timing is unfortunate. Our office is going to be closed Thanksgiving week. If you have most of you have our phone numbers, call us, text us, email us with questions. We're here as a resource. We're here to help you. Take control of what you can control, and the rest of it, let go. You all work very hard on your health. You're in a great position to weather this situation without any significant adverse events. And I have every confidence that we're going to be able to do this, and we're going to come out on the other side of this whole event more resilient, more positive, and better. So reach out to us if you need help and support. That's what's going on. And we'll keep you updated as we get updates. Okay? Take care. Talk to y'all soon.